Hi everybody, this is Venk with Always On EM. As you know, I'm at ACEP in Las Vegas. I happen to run into Carrie, who happens to have a lot of connections to where I did some of my training. Upper Ohio, the NeoMed area, I graduated from there and I did some of my clinical rotations at St. Elizabeth, and so I'm really excited to hear some of the work that you've done. Carrie, it's great to meet you. Do you mind telling us, myself and the audience, a little bit about yourself, your team, and the work you're doing?
All right. I'm Carrie Powell. I'm from Youngstown, Ohio, one of the third-year residents at St. E's Emergency Medicine program. I did this research along with a few other prior residents, one that completed an ultrasound fellowship and is now back one of our faculty members. So this was the HOCUS POCUS Quality Improvement Initiative. It was a non-randomized quality improvement study looking to compare handheld ultrasound versus standard cart-based ultrasound for IV placement. It was performed by residents amongst 3 different hospitals: an urban level 1 trauma center, an urban level 3 trauma center, and a non-trauma designated suburban emergency department. We looked to compare 6 different parameters: the number of attempts at IV placement, the total time to successful cannulation, patient pain, patient satisfaction, resident perceived difficulty, and resident satisfaction. We used a chi-square analysis to compare the total number of attempts while using an independent student t-test to compare the other parameters. Our findings were that there was no significant difference between total number of attempts, the patient pain, patient satisfaction, resident difficulty, or resident satisfaction, but there was a significant difference between the total amount of time between the handheld and cart-based. The handheld ultrasound yielded a 90-second reduction compared to the cart-based ultrasound, which, as we know in the emergency department, time is of the essence. So that was a very exciting finding for us, especially known that IV access can sometimes be the rate-limiting step in emergency department visits. Some limitations to our study included that this was a non-randomized quality improvement rather than a clinical study. There's also a lack of generalizability, as we were all residents trained in ultrasound performing this, which may not be the case all over the country. And there could be a reporting bias, as the handheld ultrasound was a novel device to some of the residents performing this. But we look forward to doing more research with this, hopefully looking to compare infection rates for handheld versus standard cart-based ultrasound in the future.
What kind of handheld device did you use?
We used the GE Air.
Okay.
It was
the two-sided probe?
Yes, two-sided, the curvilinear and the linear on the other side. We're using the linear with little tablets that were on a monitor that we were able to just wheel around with us. Much smaller than the GE Venue that we used for our cart-based.
Very cool. Well, this is really exciting for me. It brings back a lot of good memories from a time that, is a long time ago. But it's really nice to see that there's a program. There wasn't an EM residency back then at St. E's, so really great work, and thanks for sharing it. I hope you're having a great time at Vegas.
Thank you.
I wish you all the best, Carrie.
Thank you very much. It was nice.